Hey everyone, and welcome to the Nutrition Edge, where we dig into the science behind our nutrition. Ever wonder if something we all do, like how we feed our kids, could have a huge impact on their health? A new paper gives us a pretty strong clue. Today we're diving into a study from rural Northeastern Ghana that looked at how kids are growing and if they're getting enough nutrients. Specifically focusing on malnutrition and anemia, we'll explore who participated, what the researchers found about the kids' health, and what might be behind those findings. And importantly, we'll talk about what this might mean for us, with some big warnings because this research isn't quite ready for prime time yet. So let's set the scene. In many parts of the world, including some areas of Ghana, malnutrition and anemia in young children are still pretty big problems. These issues can have lifelong consequences, affecting everything from physical growth to how well a child's brain develops. The researchers wanted to get a clearer picture of just how widespread these issues are in a specific rural part of northeastern Ghana and to pinpoint what factors might be contributing to them. They specifically looked at children under 5 years old. To answer their questions, the team went into 10 rural communities in a place called the East Mamprusi municipality in Ghana. They did a type of study called a cross-sectional study. Think of it like taking a single snapshot in time. They visited these communities in June and July of 2023 and gathered a lot of information. They measured the children's height and weight to check for malnutrition, took blood samples to check for anemia, and asked the caregivers lots of questions about their families, their health habits, and how they fed their children. Then they crunched all this data to see what patterns emerged. Now, for the results, and honestly, they're pretty concerning. The study found that a large number of children in this region are struggling with malnutrition. A massive 34.3% were stunted, meaning they were shorter than expected for their age. Over 31% were suffering from wasting, which is when a child is too thin for their height, and nearly 28% were underweight. That is a lot of kids facing serious nutritional challenges. But it wasn't just about physical growth. The study also found that a staggering 59.7% of the children had anemia. Anemia is often linked to iron deficiency, and that is what they found here, with iron deficiency anemia being the most common type. This level of anemia can impact a child's energy, learning, and overall health. So what is driving these numbers? The researchers looked for connections for stunting. They found that higher household food expenditure was linked to lower odds of stunting. That makes sense, right? If families have more money for food, kids are likely to get better nutrition. Interestingly, adequate knowledge about exclusive breastfeeding was protective. But things were a bit confusing too. For instance, knowledge about feeding sick children was surprisingly linked to higher odds of stunting in the adjusted analysis. And meeting minimum dietary diversity scores, which sounds good, paradoxically showed increased odds of stunting in the adjusted model. This is where things start to get a little complex. When they looked at wasting feeding practices came up as really important. Children who ate from separate bowls were much less likely to be wasted than those who shared with their siblings. Not introducing appropriate complementary feeding, which is the food given after breast milk, significantly increased the risk of wasting. Also, not preventing iron deficiency anemia and iodine deficiency disorders were linked to higher odds of wasting. For underweight children, a really striking finding was the lack of home support from healthcare providers. Children in households without this support were over 21 times more likely to be underweight. Non-exclusive breastfeeding also sharply increased the odds of being underweight. And not meeting minimum dietary diversity scores was linked to almost 4 times higher odds of low weight. Now, for anemia, things like mothers not being satisfied with health services or services being of poor quality were linked to higher anemia rates in initial checks. Though some lost their significance later, but a really strong protective factor was having the mother's hemoglobin checked at registration, meaning the mother's blood was tested. This significantly reduced the odds of the child being anemic. Exclusive breastfeeding also showed a protective effect. However, and this is a big however, appropriate complementary feeding seemed to be linked to higher odds of anemia. And again, lack of prevention of iron deficiency anemia was a significant risk factor. This is where the researchers try to make sense of it all and where we need to be extra careful. The study highlights that malnutrition and anemia are major issues in this rural area, much higher than national averages, showing a clear regional problem. You know, the paper points out that factors like household food expenditure are crucial. This underscores that poverty and food security are big drivers of poor child nutrition. They also highlight feeding practices. Exclusive breastfeeding is known to be protective, and it showed up here, but the findings about separate bowls versus sharing meals are quite telling. Sharing from one bowl might mean some kids don't get enough food. Or it could spread germs, leading to illness that makes it hard to absorb nutrients. The point about healthcare service utilization, like home support or checking maternal hemoglobin, is another key takeaway. It suggests that access to and quality of healthcare, even at home, plays a huge role in preventing these issues. Now, let's talk about those slightly puzzling results. Things like adequate knowledge about feeding sick children being linked to more stunting, or meeting dietary diversity being linked to more stunting and underweight. The authors suggest this might be because caregivers of already malnourished children seek out more information or change their practices. It is like they learned better after their child was already sick. Or perhaps they're meeting the letter of dietary diversity guidelines using available but not necessarily nutrient-rich foods, which is a serious problem in these settings. This points to the fact that just having the knowledge or meeting a checklist isn't enough. The quality of the food and resources matters immensely. And now, the crucial bit about limitations. This is a preprint, meaning it hasn't undergone that critical peer review process yet. So we need to be extra cautious. It is a cross-sectional study, which means it is a snapshot. It can show us what is happening and what is associated with those problems. But it can't definitively say that one thing caused another. For example, just because children in certain households were underweight and didn't have home health care support, we can't definitively say the lack of support caused the underweight. It is a strong association, but not direct proof of cause and effect. Also, the information on feeding practices and health service use was based on what people told the researchers. And sometimes people might not remember perfectly, that is, recall bias or answer in a way they think is expected. And finally, they used a specific test to screen for iron deficiency anemia that, while useful in the field, isn't the most accurate diagnostic tool. It might misidentify some conditions, from my perspective. This study paints a stark picture of the scale of malnutrition and anemia in a vulnerable population. The strong links between household economics, feeding practices, and healthcare access are consistent with what we often see in global health. The paradoxical findings, however, are a really important reminder that context matters. Just providing information or suggesting certain practices isn't enough if the underlying issues of poverty, access to nutritious food, and quality healthcare aren't addressed. It suggests that interventions need to be truly co-designed with communities, considering their realities, not just imposed from the outside. Future research, perhaps following these children over time, would be really valuable to unravel these complex relationships. This is what I think nutrition is deeply intertwined with socioeconomic realities. And this study in rural Ghana is a powerful example. The high rates of malnutrition and anemia underscore the ongoing challenges with food security and healthcare access in many such communities. While good feeding practices show promise, their effectiveness is clearly hampered when families lack the resources to access nutritious food and quality healthcare. This highlights the need for integrated, community-driven approaches that tackle both immediate nutritional needs and the broader determinants of health. So, what does this all mean? It means that for kids in rural Northeastern Ghana, malnutrition and anemia are big problems. Things like having enough money for food, how parents feed their children, and whether they get good support from healthcare workers really matter. While this research is a preprint and needs more review, it gives us a glimpse into the complex world of child nutrition in these areas and the urgent need for targeted local solutions. That's it for this episode of The Nutrition Edge. If you found this interesting, please give this video a thumbs up, leave a comment below, and subscribe for more dives into the science behind our health. See you next time.